All right, hi everybody, it's Mr. G, and we're doing something pretty special today. You know that I'm involved, obviously, with you guys for 44 years, television, weather, children, Northwell Hospital, Channel 11, and myself for the last 8 years. We're at a Cohen's Children's Hospital, which is very dear to me, and we're with somebody who's in the business of saving lives, children's lives, and we're going to discuss some really interesting things that Northwell's involved with, he's involved with, and what the parents are involved with as well. So with that, I want to introduce a bright star. We're going to get into that. It's not wearing any makeup. That's okay. Dr. Jose Prince, okay? And Jose, tell us about your stay at Northwell.
Well, I've been here at Northwell for over a dozen years. It's really been a tremendous privilege to be here. It's such a wonderful thing. I grew up in this neighborhood. I grew up 10 blocks from here. So in some ways, I went away to school to train for 20 years, and I'm right back where I started.
And when you train to be a surgeon, correct?
Yeah, I'm a pediatric general surgeon. So we operate on children from head to toe. I operate on preemies that weigh a pound and giant teenagers that weigh 200 pounds.
And you say it all with a smile. So what's your love of children? Where does that come from?
It comes, I think, from at home. The wonderful family life I grew up with, my own two parents, my two brothers, and now my family life at home with my wife and my children. It's just really a recognition of how each of us fits into that cycle of life and our role to try to grow and develop children in a healthy, wonderful environment. Now,
recently, your life took a little bit of a switch and a turn. You became a bit of a TV star, huh?
Yes, I had the opportunity to be followed for a couple of years by the Ulari Films producers for a piece that they did at Netflix, which is called Emergency NYC, that just came out a couple of weeks ago.
Right, very successful.
We made it to #2 in the country, I'm told, for Netflix TV shows. So it's really exciting. As a surgeon, we're very competitive, so we were hoping to make it to #1. So maybe you'll help us with your viewers, boost all the way.
Let me ask you a question. We spoke before about different topics. We did a G thing with you on gun intervention and prevention,
yes,
which is dear to you. Saving lives, children's lives, dear to you. Surgery, dear to you. There's some really touching scenes in that clip and trailer. One of them was that you were actually trying to save a life and console a parent.
Mm-hmm.
Can you tell me how that works for you as a surgeon?
Yeah, it's one of the challenges, and I think the producers did a great job of portraying this, is that we see a life changed, especially when you talk about gun violence, in the matter of a second, and you don't really know. It hangs in the balance as to where things will go for that person and that family, but it won't be the same, and it won't be the same for that community. And I do appreciate the work you've done and that we are trying to do here at Northwell, our Gun Violence Prevention Center, to make it that no child suffers from gun violence or firearm injuries.
Yeah, like I said before, we have a history together on this, and I've attended your webinars. We did a story about you. We did a story about Michael Dowling, your CEO.
Yeah.
I'm just wondering, it's one thing to be in a series. It's another thing to be in an operating room. So there's a camera there.
Mm-hmm.
And is that a distraction for you? Is it welcome? How do you factor in another presence in the operating room?
Yeah, the first 5 minutes, it was unusual to have this big camera following. I have to give credit to the producers. They did a really great job of staying in the background and really not becoming part of the scene themselves. Having said that, once you get used to it and you move forward, it's really the work at hand is so consuming and really takes over what I'm at that moment worried about, that all the distractions go away. And that's really true of surgery in general, really. Once I'm operating, once we're, you and I were chatting, it's like a fighter pilot. You're really in the zone. This is what I need to do and focus on, and everything else you just block out completely.
Now, we did a story also on gun intervention. We shared your thoughts on that story. Can you tell me how that's going? Because it seems to me that there are just too many children dying every single day. Am I right to say it's the leading cause of death?
Yeah, tragically, it is the leading cause of death in our country for children. And you know, I just had the opportunity to go on vacation with my family out of the country, and ironically, my children were safer on vacation from a gun violence point of view than they are here at home. And any one child that dies, whether it's an unintentional 3-year-old who picks up a gun and fires it, or interpersonal violence that now it's not just a fist fight, it's a gunfight, or the random acts of violence that can be perpetrated with firearms. We really have to continue working together to do everything we can to limit it.
Now, I read recently that you started out in just a little bit of the Northeast ground level. Now 150 CEOs have been involved in different hospitals trying to spread the word about what you guys are doing. Certainly Channel 11 has tried to spread the word. How successful is it? Is the word getting out? This is not about anything other than prevention and intervention. It's not about the Second Amendment. How is that getting out?
Yeah, it's been very successful. And you mentioned Michael Dowling really has been taking the lead as one of the senior CEOs in the country to gather healthcare as really one of the great anchors of communities. If you think about communities across the country, often the biggest employer is the hospital, and many of us are anchored to the facilities. Many of us are long-term residents, the doctors, the nurses who work in that community. And so we are really getting some tremendous traction from the CEOs, and really then also applying the full weight of healthcare, not just the research, which is critical and important, but also when you think of us in terms of security for the facilities, security for the staff, and education and outreach that you can do. It's really been powerful.
There's a very powerful moment in the series on Netflix, which is called what? What's the series called again?
Emergency NYC.
There's the woman you're consoling.
Mm-hmm.
You kind of hold her.
Mm-hmm.
She holds you.
Mm-hmm.
You're filling her in on the information that you're gathering and how the child is doing. What is your reaction when you go through this? You're consoling 2 people at one time and hoping you did a good job. How do you feel?
Yeah, you feel like you've never done enough because you know, as a parent of 3 children myself, that if there are no words that can totally put someone at ease, other than everything is okay, and you can't say that because you know it's not really true at that moment. And I think so much of our energy is focused on other people that it helps me in terms of not spending time worrying about myself, and that's really helpful. At the end of the day, and it comes up in the show, we all need to account for the damage, the injuries that we all suffer together. That's one of the problems with any kind of injury, any kind of violence, is that it doesn't just hurt that one person, it hurts all of us. And I think that hopefully as we engage with something like Emergency NYC as a community, it makes each of us think about what can I do to help reduce injury, trauma, and suffering in the world around me. And it could look different for a teacher than it does for a doctor, but we all have a chance to help each other.
I have a question about parents locking up guns. There's commercials out. We've seen it all. How successful is it when parents lock up their guns in a home with a child versus unlocked guns?
Yeah, the statistics are striking for the risk of an unlocked firearm in the home having a much higher chance of hurting someone who lives in that home than it does of an intruder or a stranger. And so it's really one of the critical things. If you have a firearm, that you lock it. If you have little children around, that you make sure they don't have access to the firearm.
I think if there's something that you want to share with people concerning this topic of gun intervention and prevention. We've seen the commercials. We've done stories on it. Is there something you'd like to update people with so that they can remain current and become more active in the process?
Yeah, I think one thing I would point to that we haven't talked about yet today is really for people who are depressed and have access to a firearm. And sadly that includes young people too, teenagers, but it also includes many adults. And if you have somebody who you're worried about, and again, this looks different in different states in the country, but in New York State, you have the ability to help people and to protect them from hurting themselves with a firearm. The lethality of a suicide attempt is exponentially higher when a firearm is available to the individual.
What is the greatest gift that this series has delivered to you? What is the greatest gift working in Cohen's Children's Hospital?
So the greatest gift of the series has been the outpouring of gratitude, affection, recognition for the work that we all do as a team. And it's been really wonderful to see colleagues here in the hospital itself at Cohen's come forward. Just, you can see the pride, and whether it's someone who helps us to clean the facility, someone who is security at the facility, the nurses, the doctors, the radiology techs, the respiratory techs, that sense of pride. And to be able to reflect it back, to really say, look, they might have filmed me, but really it takes a team, it takes a whole village to do that. That's been really wonderful. And as far as Cohen's, boy, it's a dream come true. I grew up dreaming about being a doctor and maybe taking care of children the way my grandfather did in Cuba.
I thought you grew up dreaming about meeting a weatherman.
No, I have had that dream fulfilled, and I think to become a doctor and a surgeon is really it's a marathon, and so to be at a point now in my life where I can see that I get to play a role in making that kind of an impact. And in the world of pediatric surgery, we like to say you don't just save a life, you save a lifetime. And so to know that ripple effect will hopefully go on in the world for good, that's a tremendous privilege.
How does it feel to have Channel 11 involved with you and me involved with you in terms of the G thing? How has that partnership worked out?
Well, it's been so important because you're so anchored and so much a part of this community, and you've been a part of this community for so long now. And so really to show that this is something we're all in together, and that we can all do moving forward day in and day out. And really that this isn't about the flash in the pan of a Netflix show. This is about the weather happens to us every day. We go through our life every day trying to handle all of these challenges that come at us, and we're all in this together. And some of it you can't control, but it's raining, it's sunny.
That's the weather part,
but some of it we do control, right? I bring the umbrella. I can do something about my response to what's happening around me, and I think that partnership has really been wonderful for us. So thank you for it.